I'm Dr. Sandy Baird, owner of Riverstone Chiropractic here in Oakland, California. Today we're going to be talking about tennis elbow, so pain at the lateral side of your elbow, and the technical name for this is lateral epicondylosis. Okay, that's actually the new name for it. It used to be called something ending with itis, so lateral epicondylitis, but now it's epicondylosis. The reason for this is that it's not always an inflammatory condition. Okay, when you look at the ending of a word, itis, that means inflammation. And if you look at the end of the word, osis, O-S-I-S, that does not mean inflammation. It basically means a degenerative process is happening, but it's not necessarily inflammatory. So you can press on the area on the lateral elbow, and it might be tender or painful, but there's not swelling. There's no indentation that's left. There's no obvious difference between the two sides if you have epicondylosis. So what does lateral epicondylosis mean anyway? Let's break it down a little bit. So lateral, it just means towards the outside of the body, right? So if this is medial, this is lateral. And for the elbow, if this is medial, this is lateral. Epicondylosis, the main word from there is epicondyle. So the epicondyle is it basically just means the bony area right on the outside of your elbow. It's based on a reference from the actual bone on the humerus, and you don't really need to know that unless you're an anatomist, but that's where the term comes from. And so why do tennis players get this on the outside of the elbow? You would think that if you're hitting the ball this way, the inside of your elbow would hurt. If you're swinging for a serve, you would think the inside of the elbow would hurt. But what actually is the reason for this is the backswing, okay? So the backswing requires the extensor muscles, the muscles that come off of the lateral epicondyle, to fire repeatedly. And with most people, the flexor muscles, the muscles that let you do this, are weaker than the extensor muscles that let you do that. So when your body is asked to do this repetitive motion, one that you're doing hundreds of times in a game or practice, and those muscles are weak or have been injured, there's going to be a problem. And so that's where the tennis elbow comes from. It's actually the tendon that attaches the extensor group. So I don't know if you can see this on camera, but there's a group of muscles called the extensors on the outside of the forearm here that attach right in here to the lateral epicondyle, and they attach via a common tendon. So it's that tendon that gets degenerated or inflamed if you have tendinitis. But what I'm seeing more and more in clinical practice is the osis. So it's that tendon getting degenerated based on overuse or initial injury, basically. And what happens once a muscle gets injured in the first place is that the muscle does not have enough circulation, so it does not have enough oxygen. And once the condition called hypoxia, which is just meaning not enough oxygen, once that's in place, the body starts an inflammatory process in which adhesions are laid down. Once the adhesions are in place, the area is a sticky mess. It's like someone poured glue into the muscle fibers and the area is just not moving right, it's painful, and the biomechanics are not in place. The thing about adhesions is that they remain until they're treated. They do not go away on their own. Ice does not make them go away. Stretching does not make them go away. Ibuprofen, not going to make them go away. The only thing that's going to make them go away is getting active release techniques treatment or a similar type of treatment which is designed to reduce the adhesion. With ice and heat and stretching and all that, you might get some temporary relief, and usually what will happen is a tennis player or anybody else who develops this lateral elbow pain, they will cut back on their activities, and then after a few weeks they'll notice, oh, hey, my elbow pain's gone away, this is great. But when they start to add back in their activities, the problem comes back. And so to really make sure that the problem is not going to come back, we have to address the adhesions. The active release techniques treatment for lateral elbow pain is going to involve some muscle work along the lateral muscles here, the extensor muscles. And it may also involve checking out the shoulder, the neck, and the back. So oftentimes there's a biomechanical problem in the shoulder due to an injury or weakness or overuse in the shoulder. And so the same thing happens in the shoulder. adhesions develop either the rotator cuff muscles or in the trapezius or even like the pec minor, pec major. And those things throw off the biomechanics all the way down the chain into the elbow. So a good chiropractor will look at the whole picture. They're not just going to adjust the elbow, but they're going to do the muscle work at the elbow and check to see whatever else is involved all the way up the chain, even up into the neck. The nerves that innervate the elbow start up here. So you got to look at the whole picture. In terms of the protocol for addressing the extensor muscles, it's going to look something like this. So you're going to shorten the muscle, and then the practitioner is going to take a thumb or a hand contact into the muscle and maintain a certain tension while the person lengthens out the muscle. So it's designed, you can see there's a little bit of tension there, and it's not skin tension, it's actually getting into the muscle and developing the tension on the adhesion to break the adhesion. And there's several muscles here, some that cross the elbow, some that don't. Your practitioner will be able to figure out the exact muscles that they need to work on, but that's what it's going to look like. And I'll throw a picture in there too so you can see at least a still picture of what ART, active release techniques, looks like. If you have any questions about tennis elbow or any other sports-related injury, please feel free to send me an email, info, @riverstonechiropractic.com, or you can give us a call at 510-465-2342. Thanks for watching.